Good morning. I'm Andy Grogan-Kaler. I'm an associate professor at the School of Social Work, and I'm talking to my friend and colleague, Diego Lucumí in Bogota, Colombia. Good morning.
Good morning, Andy. Nice to talk with you about these
It,
interesting topics.
so as part of this conversation that we've been having with different researchers, I'm wondering if you could tell me the particular social issues that you're concerned about?
Yeah, basically my work is in public health. This is the overall area of my research. But in specific, I'm working on the prevention of cardiovascular disease, but not only in interventions, but just other important issue and working is try to understand the social factors related to hypertension and other cardiovascular problems in the context of Colombia. Basically, I'm interested in trying to understand more about how issues like income inequality and poverty at different levels influence the risks and disparities in hypertension in Colombia.
So I assume that that leads into why you do research on these issues. And I'm actually going to maybe fold together two of my next questions. And so ask you, why are you doing research, and what are you hoping to learn in researching these issues?
Yeah, there are several reasons for doing this research. One of them is that, in particular for Colombia, we don't have enough information about how these social factors at different levels, at the municipal level, state levels, or at the national level in general, influence the risk of these public health problems. So one first reason is we need more evidence about the contribution of these social factors to these problems. The other is that in my work, I use participatory approaches and working with some communities and other stakeholders. So the idea is also to conduct this research with the idea these different stakeholders can have not only more evidence but also the possibility of influence or advocate for changes in policies that could be can change or modify these social factors that shape the risk of hypertension or the risk of different cardiovascular disease in the Colombian context. So, or the other reason is use the evidence for informed public policies. So that is another important reason for this kind of research. The I think is related to the two first reasons. I think we need to also to create to change the public agenda. There is no, in order to inform public policy, we need also to provide information to the overall audience about how these problems, uh, these social problems, have an implication in public health issues. So when I am talking about evidence, it's not just academic evidence. We need to use research for create different kind of evidence or to provide different kind of evidence to different audience in order they can use that evidence for changing the context, changing the policies, changing the different conditions that are related with the population health in Colombia.
So you've really, I think, anticipated a lot of my next question. You've talked about this participatory approach that you use, and you've talked about this, or I know from working with you in the past that you use a mixture of qualitative and quantitative approaches. How I guess do you see this research moving forward in alleviating suffering? Is it really at the policy level? Is it at the practice level? Is it at one or the other? Is it at both? What would you say?
I think that both, but it's also important to say, Andy, that this is a long-term process.
Mm.
In particular, when in our case, not necessarily we have enough evidence, and so in some occasions, we face the challenges of having the information or having even before having the budget for conducting research is not something easy in many occasions. So that is the first problem. So then in other occasions we have the data, but not necessarily we have good access to the data for trying to generate this evidence. So there are many challenges, but the idea is to, at the end, to use this evidence for policy interest, for policy reasons, but also for for doing something in the real life, of the daily life of the people. So for interventions, um, so it's for both, but it's a long-term process. In particular, when we are working with communities, because, for example, I'm working in a city in the west part of the country. And this city has one of the highest level of poverty in the country, and people there face many challenges. So there are many problems at the same time. Uh, so it's not easy to try to talk about one particular problem, because at the
Yeah.
same time people have to face others.
Well, yeah, absolutely. I just want to comment on something you say that really struck me, that it really is a long-term process. And I think, I've worked with you, I've worked with other folks, and I think there sometimes has been in my mind, okay, we did the study, or we wrote up the research, we published the study, is the conversation changing? And it's only in some areas. I've been at the university, I think, 15 or 16 years, and now I start to look back on some of the issues I've worked on, and I say, oh, well, the conversation was different 15 years ago, and now it is it is somewhat improving. So it really is a long-term investment in this kind of process, I think.
The other issue is that we need to try to create other way of communication with the other audience, because in many occasions we are talking about research based only on the academic perspective.
Correct.
So when we are working with communities, for example, we need to find a way to communicate in the same term, using the same language.
Exactly. Yeah.
So it's also challenging. Yeah, and that is the other reason that explain why this is a long-term process. Because we need to create new ways for communication, for understanding, and in some occasions, the other problems when we are working or we are talking about research is that the mistrust, because previous work with communities, there is a very bad
Right.
experience. So people from communities say, okay, yeah, we need to be careful with these researchers that come from the academia, because we have a bad experience working with them. So in many occasions, the first part of the process is basically try to create a good relationship with people.
Well, that I think brings me to the last question I have for you today, and I suppose bearing in mind this idea of the long-term process that we've been talking about, creating trust. As your work moves forward, what evidence-based practices or policies would you hope to see in the future coming out of your work?
Yeah, we are working on the try to use evidence for inform. policies and intervention at different levels. So one first level is the maybe at the community neighborhood level, try to create interventions that are with the goal. I think there are different goals there. One is intervention that can increase the awareness of people about the social problems. So that is one kind of intervention, or as a part of the intervention. That the idea is that intervention contributes to increase the level of awareness about the problems, and try to engage people in conversations about these social problems and how these social problems shape health of the population. So that is one aspect. There are also specific interventions. In this case, because my work is in cardiovascular disease, so we are trying to create, for example, more opportunities for physical activity at the neighborhood level. But these interventions are based on the evidence from research, formal research, but also from the evidence that people have or people could generate using the approach that they have for generating evidence. The other important issue is to the policies at the local levels. For example, the idea is to show how, for example, issues like education or income or occupation plays an important role in terms of shaping risk for cardiovascular problems. So we have to start or to maintain an open conversation with local authorities, local governments, to say we need to try to improve these conditions, these social conditions, these economic conditions. Not only for this is good for the economy, the local economy, but it's also good for the health of the population at the local level. But we need to move the conversation also. We need to move the evidence to the national level, because many of the solutions to these social problems are related to decision at the national level. So what I see is that we need to use evidence to inform decision to these all levels. But I said before, we need to think in a long term, thinking that this is a long term process. We need to work step by step, create awareness, involve more people. So we need to create a discussion with many actors, not only with the health sector, because that is other of the problems we have from the in public health. In many occasions, we only are working with the health sector, but most of these policies, most of these social policies, the decisions or the solutions are different in different sectors. So we need to engage a broad audience for addressing these social problems.
All right. Well, thank you so much for taking your time today. I've enjoyed talking to you. I'm glad you could be part of our discussions for this course, and I'm looking forward to the conversations that you and I have in the future. So thank you again for your time.
Thank you, Andy, for the invitation. Great to talk with you.